We're talking about TMS, or Comorbid Substance Use and Major Depressive Disorder. And our speakers are, let's see, am I going the right way? Myself, I'm Kathleen Brady. I'm from the Medical University of South Carolina. We have Hamid Akhtiari, who is from the University of Minnesota. And then finally, Victor Tang from the University of Toronto. And what's your experience in terms of acceptance and treatment of substance use disorders?
So these are the first generation RTMS, second generation ITBS, third generation accelerated protocol, and fourth generation is individualized, circuit-based, imaging-based. You do imaging and then you target a specific area.
Basically, are there shared neural substrates that if you were to target that shared substrate, you would be able to treat both disorders? And that's basically the goal of what these trials try to do.
Specifically in the field of substance use disorder, we recently put together a new paper that is under review with 141 clinical trials in over 4,000 people with substance use disorder.
You know, most studies for RTMS 780 do exclude for active substance use disorder, although oftentimes nicotine is ignored. Sometimes SUD trials include people with depression and anxiety disorders. It's more common that it's just excluding these kind of severe mental illness like schizophrenia or bipolar disorder.
But the main issue is there are just only 9 reports of severe adverse effect from these 4,200 something trials, okay? And these 5 severe headache and 1 case of seizure, and this one happened in the sham group.
You know, one of the things that we wanted to set out to do was to provide a guideline for people that treat depression. Right, and it's a different world over there in people that never see substance use disorders, and it's much more conservative in terms of what they're willing to include.
So what is transcranial magnetic stimulation? It is a non-invasive form of brain stimulation that changes the magnetic field to cause electrocurrent in specific brain regions through electromagnetic induction.
For cannabis, if you are using prescribed or medicinal cannabis, you are fine. But if you are using recreational cannabis, it's contraindication.
Another participant said, and I'm just going to skip to the highlight, I'm hoping to kill 2 birds with 1 stone. I don't know if it's the same as depression, but I know RTMS has helped people, including my sister, with depression. So, you know, what we'll see is that, you know, patients have multiple things coming in, and we prescribe things that have a certain indication, but everybody has hopes that they just get better overall. And a better overall means a better of everything.
It might be interesting. I have a patient that she was recording the TMS sound in the TMS sessions, and he was mentioning that I basically, when I feel a little bit depressed, I just play the sound. So it's something like a conditioning or whatever. So even the sound was helping her. If people are taking any concurrent psychotropic medications, that should not be a contraindication for people to receive treatment with TMS. So that is one point. We as psychiatrists are a little bit kind of afraid of seizure, but if you are in neurology clinic, people seize all the time in front of them. So, and even, they have units that they just wait for people to seize. So, and it is hard to make people seize with TMS. Even there are studies that because of this kind of seizure clinic, they want to make people seize, and they have been using TMS with the highest power to just on the motor cortex, which is the most sensitive area, trying to make people seize, and they are not that much successful. So they realize it's not a protocol to be able to make people seize. So TMS is not designed to put enough energy to make people seize. So it is not like ECT that we have that level of energy.